I have been a senior health specialist for close to 20 years, and I want to share something with you that most doctors do not say out loud. There are 5 common screening tests that I personally would think twice about after the age of 65, and in some cases I would refuse them altogether. This is not anti-medicine advice. This is not rebellion for the sake of rebellion. This is me telling you what I would tell my own mother. Big studies show that more testing is not always better testing, especially once your body has passed a certain point in life. The US Preventive Services Task Force, the independent group that guides doctors, agrees that some routine tests should slow down or stop entirely as we grow older. Did your doctor ever call you in for a test that left you feeling anxious for a week? Have you ever gone back the next year and had the very same test with the very same result and walked out wondering what the point was? You are not alone in feeling that way. Millions of older adults go through this every single year. You have probably already done everything you were told to do. You showed up, you fasted, you lay on the cold table, you held your breath. And the reward you got back was often a small scare or another round of pokes and probes. The truth is that some of these tests do more harm than good after a certain age, and almost no one is talking about it. I am Dr. Michael Hartwell, and I run a clinic focused on adults over 60 in Phoenix. I have helped more than 2,000 older patients make smart choices about their screening tests. I have also seen what happens when people get the wrong test at the wrong time. The harm is usually quiet. It does not show up as a single bad moment. It shows up as anxiety, false alarms, biopsies you did not need, pills you did not need, and surgeries you did not need. Let me say that more clearly so it lands. When a test finds something slow and harmless in a body that was never going to be harmed by it, the medical system often treats it anyway. That is what researchers call overdiagnosis, and it is one of the biggest hidden risks in senior healthcare today. Most people assume that more screening always equals more safety. That is the gospel we have all been taught, but clinical evidence suggests the opposite is true for many older adults. Large studies reviewed by the US Preventive Services Task Force have made it clear that the benefit of certain tests shrinks as we age, while the risk of harm keeps climbing. Think of your body like an old car. After a certain number of miles, the engine is going to wear out no matter what you do. Running it through the diagnostic machine every month does not make the engine younger. It just creates a long list of small problems you now feel pressured to fix. If this is making sense so far, drop a number in the comments. I want to know who is still watching. Now let me walk you through the 5 tests I would personally refuse, delay, or seriously rethink after 65. I will be honest about the science, honest about the trade-offs, and I will tell you exactly what I would do instead. First, I would rethink the routine mammogram after the age of 75. The US Preventive Services Task Force notes that the evidence for mammograms in women over 75 is simply not strong enough to say the benefits clearly outweigh the harms. Large studies show that mammograms save the most lives in women between 50 and 74. After 75, most breast cancers that are found grow slowly, and treating them often causes more suffering than the disease itself would have. According to the American Cancer Society, women should keep getting mammograms as long as they are in good health and expect to live at least 10 more years. So this is not a flat refusal. It is a thoughtful pause to ask whether the test still matches your real health situation. Second, I would refuse the PSA blood test for prostate cancer after the age of 70. The US Preventive Services Task Force actually recommends against PSA screening for men 70 and older, and they give it their lowest grade, a D recommendation, which means the harms outweigh the benefits. Prostate cancer is usually slow growing. Many men die with it, not from it. Finding it late in life often leads to biopsies, surgeries, and radiation that leave men incontinent or unable to perform sexually, all to treat a cancer that likely would never have hurt them. Large long-term studies have shown that PSA screening did not lower the chance of dying from prostate cancer for most men. Knowing that, I would not agree to the test at 72, 75, or 80, unless I had a strong family history and a long life ahead of me. Third, I would stop routine colonoscopies at 75, unless my doctor had a strong reason to keep going. The US Preventive Services Task Force recommends colorectal screening from 45 to 75. And between 76 and 85, they say the decision should be very personal. After 85, most guidelines say to stop. The reason is simple. Colonoscopies are very good at finding polyps, but most polyps take 10 to 15 years to turn into cancer. If you are 75 or older and your previous colonoscopies have been clean, the chance that a new polyp will harm you before something else does is small. Add in the risk of the procedure itself, which includes sedation, bowel injury, and bleeding, and the math starts to lean toward skipping it. Hit the like button if this is useful so far. It takes 1 second and helps this video reach someone who needs it tonight. Fourth, I would question the yearly Pap smear and HPV test after 65. The American Cancer Society and the US Preventive Services Task Force both agree that women can stop cervical cancer screening at 65 if they have had normal results for the past 10 years. The virus moves slowly. If your recent tests have been clear, your risk at this stage is very low. I have met women in their late 60s who are still getting Pap smears every year out of pure habit. That habit is doing nothing for them. It is just creating more anxiety and more false positives, which lead to more biopsies. Fifth, I would not do bone density scans every single year. Bone density tests, also called DXA scans, are useful, but the National Osteoporosis Foundation says repeat testing every 2 years is plenty for most people. Some research suggests that longer intervals of 4 to 5 years are safe for women with normal bone density and no major risk factors. After 65, your bones do not change so fast that a yearly snapshot tells a different story. A single baseline scan, followed by another one after 3 to 5 years, gives you almost the same information without adding extra radiation or extra worry. Make sure you subscribe before you leave this page. More honest videos like this are coming every week. Let me tell you about a patient I will call Margaret. She was 73, a retired school teacher, and she had been getting every screening test her doctor ordered for 15 straight years. Every mammogram came back with something the doctor called "watch closely." Every follow-up led to another ultrasound. Every ultrasound led to another biopsy. One day she came into my office and told me through tears that she felt like her body had become a never-ending science project. We sat down together and looked at every test she had done in the previous 5 years. Almost none of them had changed her treatment. Almost all of them had changed her sleep. She said to me, and I will never forget this, "I spent the last decade scared of diseases I never actually had." That conversation changed how she approached every test from that day forward. Now let me talk about real warning signs that should never be ignored at any age. Please call your doctor right away if you find a new lump in your breast that does not go away after your next period, or any lump at all after menopause. Seek medical attention if you have any rectal bleeding, even a small amount, because that is different from skipping routine screening. Do not ignore unexplained weight loss of 10 pounds or more without trying, because it can point to things that need real follow-up. See your doctor if you have new bone pain after a minor fall, because a fracture in an older adult is not something to tough out. Finally, schedule a visit if you have any unusual vaginal bleeding after menopause, even spotting, because that almost always needs a closer look. Most of these findings will turn out to be nothing serious. But ruling them out properly matters, and no responsible doctor, including me, would ever tell you to skip that kind of care. Does any of this sound like your own story? Tell me in the comments. I read every single one. I am sure some of you are already asking about the home remedies and supplements that get pushed on the internet for bone health, prostate health, and colon health. Let me address a few right now. Does drinking massive amounts of calcium build strong bones after 70? The short answer is no. Extra calcium beyond what your body needs does not turn into stronger bones. It often turns into kidney stones or constipation. The better approach is a steady diet with calcium-rich foods, plus sensible sunshine or a low-dose vitamin D supplement your doctor agrees with. Does saw palmetto shrink your prostate? The short answer is no. Large trials have shown it does no better than a sugar pill for symptoms. The better approach is to talk to your doctor about real treatment options if symptoms bother you. Does juicing celery or drinking apple cider vinegar prevent colon cancer? The short answer is no. Large studies do not support that claim. The better approach is to eat a colorful plate of vegetables and whole grains most days and keep your weight scent. Lady, are you finding this useful? Let me know in the comments. Your questions directly shape my next videos. Here is your action plan. These are steps you can start tonight, no prescription pad needed. 1. Write down the date of your last screening test for the 5 areas I just covered. Pull up your records or call your doctor's office and ask. 2. Schedule one calm conversation with your primary care doctor about which screenings still match your real health picture, not just your age. 3. Ask your doctor to estimate your 10-year life expectancy honestly. This single number changes every screening decision. 4. Write down your personal values. Would you rather know about a slow cancer and treat it, or would you rather not know if treatment would not extend your life? 5. Say no out loud kindly when a test does not fit those answers. 6. Keep doing the tests that matter for your age and stage, including blood pressure checks, cholesterol blood work, eye exams, hearing tests, and skin checks. 7. Bring a friend or family member to your next appointment, so you have an extra set of ears for shared decisions. If this information is new to you, share it with someone who needs to hear it. That one share might save someone from a test they did not need. I want to leave you with something honest and a little personal. You deserve more than a reflex order for a test that was designed for a 30-year-old. You deserve a doctor who looks at your whole story, not just your age on a chart. You deserve to be asked what matters to you, what you enjoy, what you still want to do, and how long you hope to do it. Those answers are the real screening tool, and they matter far more than any machine in any lab. Your age is not a diagnosis. Your worth is not measured by your last test result. You are not a passenger in your own health journey. You are the driver. Speak up. Ask the awkward questions. And if your doctor cannot answer them in plain language, it is fully okay to find one who will. Hit the bell icon so YouTube notifies you when I post the next one. If this video gave you something useful, hit the like button right now. It takes 1 second and it makes a real difference in how many people this channel can reach. If you have not subscribed yet, hit the subscribe button now. More videos like this are coming every week and you do not want to miss them. If you know someone who needs to hear this, share it with them right now. That one share might change the way they walk into their next appointment. And turn on the notification bell so YouTube tells you when my next video drops. YouTube only shows new videos to a small percentage of subscribers unless their bell is on. Thank you for staying with me all the way to the end. Take care of yourself, trust your voice, and I will see you in the next one. Do not forget to subscribe. You do not want to miss the next one. Every medical recommendation in this video is meant to support a thoughtful conversation with your personal doctor, not to replace one. Any decision to stop or skip a screening test should be made together with a clinician who knows your full history. Please do not stop any prescribed medication without speaking to your doctor first. The information shared here is for general education and reflects widely accepted guidance from organizations like the U.S. Preventive Services Task Force and the American Cancer Society.